Welcome to our very first episode of
Absolute Talks
with Jack and Conrad. We thought our first guest would be Jack. Who's better to help our clinicians restore hybrids than Jack? Been doing it for 20 years now, Jack. So, do you want to discuss with our clinicians how you've helped so many clinicians throughout the years effectively restore a hybrid?
Well, now we have two ways we can go about it. We have an all digital way and we have an analog traditional way. We'll come back to the all digital way later in another episode, but today we're going to discuss the traditional way. It's very, very easy. First appointment, go ahead, have the patient in, take an abutment level impression, send that in to me. That's appointment number one. Once I receive it, I'm going to go ahead and give you a call, go over details and review the case with you, and I'm going to make you a verification jig. I'm going to send that verification jig back to you for appointment number 2. Once you receive the verification jig back, you'll go ahead and try it in the mouth, make sure that it seats passively.
And on a side note, don't screw it down, just hold it in place or just use one screw so we don't bend it in place.
Once it's verified, then you can go ahead and take that master cast and you're going to index the model at the 12, 3, 6, and 9 position. And you got two choices. You're going to take that transitional out of the patient's mouth, you're going to screw it on the master cast, and you could either take a large putty to put it over the top or you can overfill an impression tray. You're going to want to make sure that you come down and completely engage the indexes. You're going to take that off. You're going to deliver the transitional back to the patient, and you're going to send me either the putty or the impression back along with the master cast. Once I receive that in the laboratory, I'm going to pour that up with acrylic, and that's going to be used to go ahead and get my mounting, as long as critical data like the midline and the size of ledge position. Once again, we'll review to see if any changes need to be made, and we'll go right to the prototype stage. That will be your third appointment. At third appointment, you will deliver the prototype and make any corrections that might need to be made at that time, or you can also get an aesthetic provisional. The aesthetic provisional in the end, the patient gets to keep, so it's a nice idea. You could let them walk in that. And then after that, we'll go to fourth appointment, which would be delivery of the final.
And I think you agree, it's really important not to be adjusting the final zirconia hybrid.
We'll work out everything in the prototype stage.
Yeah, and that truly is the name of the game. Prototyping, make sure you get patient acceptance, patient sign-off, and Jack and his team copies what you send and the patient goes home.
You'll never receive a surprise at the delivery of the zirconia final. Everything's been worked out previously. It should be no longer than a 45-minute appointment.
Awesome. We invite you to restore your next case with that. If you got any questions, you can contact Jack through absolutedentallab.com or Jack at absolutedentalservices.com.
Now, hope to hear from you soon.
If you would like to learn more about hybrid workflows, please download our comprehensive clinical workflow protocol at absolutedentallab.com.